Welcome back. I've got Reid Zeising online. Reid, how are you?
I'm doing fantastic. How are you, Michael?
I am great and really looking forward to this conversation. I love talking with fellow servant leaders, and you're definitely one of them. So why don't you share a little bit about you, and then we'll jump into the conversation.
Well, thank you. Name's Reid Zeising. I'm CEO of Gain. Gain is the largest revenue cycle management company handling litigated and complex claims. We are in general attempting to collect for healthcare providers on patients that they otherwise wouldn't have received payment for. So this is services to the uninsured, the underinsured, and those really disadvantaged by the system as it works, and really found a niche and a passion for collecting, providing access to care for those in need, and collecting for doctors who are proving and providing, really worthy services.
Worked in primary care for almost 15 years in administration. And I remember speaking with a physician that had worked at a larger practice. And he said to me, he said, the best month I ever had, and he mentioned the month, I forget what year it was in the month. He said, I was able to collect 65% of what I billed. And the people, the reception staff, like, oh, and I said, okay. I said, let me frame it to you this way. I said, Patty, you know how much you make and how much you bring home. Yep. Okay. You put in those hours, you put in that effort, and you say, okay, I put in 40 hours. You know what? I'm only going to pay you like 65% of those 40 hours. And that's going to be your best week. The rest of the time, you're going to get maybe 50%, maybe 40, maybe 30%. That's horrible. Of course it's horrible. The work's being done, but the system has so many issues, and I know, and I'm not going to get into, the politics of healthcare and all of that, but it's unfortunate because and I worked in a lot of areas that provided healthcare to underserviced areas or new immigrants or people that, quite frankly, have never seen a doctor in their life before. And it's like, okay, let's get you the care you need to be able to do what you need to do. Uh, and as you said, like in the pre-show, we talked about it, where the insurance companies many years ago, kind of switched from, we're here for the provider to we're here for the shareholders. And that is a shift that we have seen and we continue to pay for in more ways than one, in my opinion. Okay. I don't want the big guys coming after me, especially if I have to file a claim. I know how that's going to go now. Thanks, Mike. Good job. But in all seriously, it's so important to do this, and you're leveraging, obviously technology to help with this. And now with, the advent of being able to access tools like AI and HEI and all the other tools that have been around, it's making it easier for you to help these organizations collect, what, may have been an impossibility or really challenging in the past. So why don't you share the journey a little bit about, how your organization is leveraging the latest technologies to help these organizations and people out?
Sure. And thank you. To your point about the politics and like treading on that lightly, there's really no reason to. Let's just call it what it is. It's driven by money. And the way that our system is set up, and if we want to advocate for change of the system, that's an entirely different conversation. But the way that politics set up is it's run by money and it's run by lobbying interests. And two of the most powerful on the planet are, the insurance, and whether that is health insurance or third-party liability carriers. And let's just do some simple math. Third-party liability carriers alone, last year, the year before that, made over $100 billion net. Net means after their lobbying expenses, right? Those are pre-tax deductions. So my point is, we spend millions, they spend billions. Who has more influence? They do. End of story. Go back, you were asking, and to point to the moment in time in which fundamentally the insurance industry changed. For our parents These were collectives, and they were for the policyholder's benefit. And there were claims adjusters that were in your local community. And they came out, and when you suffered a loss, they paid for that loss. And insurance companies made money by keeping more of the premiums that they paid than they paid out, but they made a reasonable return. And Allstate in 1994 hired McKinsey. And after a 2.3, I believe, $million fine for failure to disclose, the documentation has come out. You can now find it online. There's 20,000 pages available, in which McKinsey fundamentally presented to the Allstate board that they should shift their focus from for the benefit of policyholder to for the benefit of shareholder. And they built, in essence, what is a claims denial platform. And let's not kid ourselves. People in the insurance industry, how do you make money? You take in premiums, you invest those premiums, and you pay out less than that total. End of story, right? So the incentives are not aligned with the policyholder. And the development of Colossus, which started in 1994, and roughly in that year, Allstate made about $240 or $50 million. 10 years later, after the implementation of Colossus and claims denials, they made $2.5 billion, right? And that today, collectively in third-party liability carriers, is over $100 billion annually. So my point is, we got involved in this business to provide access to care for those in need. Ours are all complex claims. So you were talking about the doctor whose best year was 65% of billed charges. There are many things that go into that calculation. First of all, your charge master, right? What are healthcare providers charging? Doctors get anxious and they start to charge more. Those charge masters go up. That brings in all sorts of complications. It's lack of transparency, right? That I think we all agree that we need in this space, but it is also leads to lower collections as a percent of your billed charges. And let's be clear, Medicare and Medicaid claims for the vast majority of CPT codes are not profitable for doctors. So commercial insurance, workers' comp, personal injury, etc., are all compensating for the subsidies that doctors provide those government agencies, right? So you could have single-digit Medicaid reimbursements on certain billed charges. You could have mid-teens to perhaps 20s for Medicare. You could have mid-20s to perhaps 30s for commercial. And on litigated and complex claims, on average, lots of things, we work in all 50 states, you're probably averaging closer to 50%. So yes, specific orthopedic groups with reasonable charge masters may receive 65% at the absolute best, but to your point, they are simply not being paid for the services that they're providing. And in answer to your question about technology, we were way behind, right? Colossus started in 1994. Right? We began what was originally Cherokee funding, in which we were providing bill-paying services and paying for medical treatment for those who had been injured in an accident and through no fault of their own. That portfolio grew to be quite large. We became the largest player in the Southeast. We then became top 10 in the US. And as we did that, I built a software platform for us to manage our own receivables, keeping up with lawsuits and litigation and filings and dockets and a variety of case updates to assure that we could get repaid at settlement. What happened with that platform was, as a quant, I started to gather data. I started to gather data on case characteristics. Was it soft tissue? Was there a broken bone? Was it catastrophic? I started gathering information on jurisdiction. Where was this claim located? And on third-party liability carrier, who was the counterparty, right? And we did this to try and get to what these cases would settle for, and therefore what dollars would be available to reimburse either lien holders or doctors. And what we did when we built that technology was became the largest kind of data aggregator for these types of complex claims and began offering those services to healthcare providers in addition to our own portfolio, which had been financed. And we would say to doctors, and this just makes sense. If we were willing to purchase those claims for 30 cents on the dollar, as an example, attempting to collect a year or two later, maybe 50 or 60 cents on the dollar, why wouldn't I go to you as a doctor and say, I will service these, I will get the case updates, I will communicate with the law firms, I will help you with all of your needs for access to care, I will provide bills, notes, and records for free to those who need them, right? And I will provide that service simply for a percent of collections, right? So the 50 or 60 cents, whether we were charging 10 or 15% of those collections, was going to net a doctor's office 50 something cents, high 40s, low 50s. They would much prefer that to 30. And people ask, like, Reid, why are you doing that? Like, look how much money you make when financing these claims. And I said, yes, but if we are truly to juxtapose Colossus, if we are truly to provide care for those in need, then I'm the one that has to have the burden of growing the business dramatically with dramatically more providers utilizing our service at much lower margin, because the doctors provide those services. The doctors are the ones who should benefit. And independently, we should provide a service in which we are compensated, but not to the extent that we were previously. So I really accepted that. The data that we began gathering, and then of course, we started doing this in kind of 2016, 2017. At the time, we were just calling it predictive analytics, right? This was not artificial intelligence yet. And fast forward, the singularity, right? Ray Kurzweil, most accurate predictor of all time in terms of technology changes, in my opinion, right? It's the confluence of nanotechnology, biotechnology, and computer processing power that we are now experiencing today and that will continue over the next number of years. So we utilize all of that to come up with what we anticipate settlements will be that will allow us to, in essence, share with doctors that they should be seeing these patients, that ultimately they will be reimbursed seeing patients with these types of characteristics. And so there's duration risk, right? There is duration that hurts cash flow for doctors and ultimately justifies, in my opinion, and in any sort of economic argument, doctors receiving more in terms of reimbursements for services that they provided years before getting paid. So today, we separated out Cherokee, the financing arm, and the portfolio that I mentioned from Gain, which is the servicing platform. And that servicing platform with artificial intelligence on intake, underwriting, case management, as well as risk management, the collections, the settlement, and the reimbursements. It is permeated throughout our organization in every single step. Most of our 150 employees utilize agents themselves. In other words, we have many more employees than we do the 150 or so that we have, right, with the utilization of AI. And so those tools, again, though, are all to just juxtapose somewhat the massive money spend and the massive systems advance that the insurance industry has since starting in 1994.
Thank you for painting that picture. And again, I worked in the sector, and that's the best descriptor of the challenges. I've spoken at Becker's Healthcare Conference on things, and talking with doctors that have said, I've been practicing for this many years, and I worked more hours this year than last year, and I'm making less. And again, it's one of those, you do kind of the dog head tilt, like, huh? And you understand why. Healthcare is complex because, well, we're dealing with humans, and health is a challenge. But that pinnacle moment in 1994, made it even more complex. And it's one of those things why it's so important, and I'm thrilled that you're on the show, is to bring more awareness of these challenges to the public so they demand it. Because yes, we want better healthcare. We want to go to the doctor. We want to be helped. We want to be fixed. We don't have to, take out a third mortgage to pay for our medical bills and things like that. all valid. But on the flip side of it, we want our healthcare people and organizations to, I want them to be able to make money and be profitable and be in business, because otherwise, as the case you gave a moment ago, where doctors look at go and they go, I'm going to lose money if I see this patient, yeah, because I'm not going to make enough to make it worthwhile. And when we start having that situation, then all of a sudden you have less and less providers seeing patients that are in need. And I sat on government committees and all kinds of other stuff in Canada on healthcare project. And Canada's got its own healthcare system woes for sure. It's not free healthcare, people. I pay about 13% sales tax when I'm in Canada, so it's not free. Nothing is free. But one of the things that we talked about quite a bit, and this was over a decade ago, was what we referred to as the silver tsunami that was coming, which is the population over age 65 was going to double in the next 10 to 20 years. Well, guess what? We've hit that 10-year plateau. We're seeing it, and over age 90 will triple. Well, those are huge populations, that huge usage of the healthcare system. And the same numbers are going to be the situation in the US, where these types of people are going to have some really complex cases, a lot of comorbidities going on. And it's like, and you mentioned something a moment ago, and again, it's just one of those things that hit home was, a doctor may not see, let's say you do a project. I go to work and I do this project for this client. Okay, I'm going to get paid like 4 years from now on it. If it's a big payout, awesome.
Correct. Right.
But if it's like nominal, it's like, why? And it forces these clinicians and organizations to get on this treadmill, hoping, for those, gains. And you're not going to see those results for eons down the road. And you go, oh, this system is messed up. And I think that's where people, and how do you simplify it? Well, one step at a time, if you can. But again, 1994, there's a lot of entities that have no desire whatsoever in changing a thing. And they've got the billions to make sure it stays that way. And short of something dramatically shifting, like public opinion, and going, no, we're not going to take this anymore. This needs to be fixed. That's what will happen. And I'm not a pessimist, but I'm not optimistic about it happening anytime soon, just again because of the numbers that we're looking at.
Well, one of the amazing things that I think is, with those lobbying efforts, right, and with those dollars, number one, and it's complicated. I get it. You have a hospital lobbying group that's extremely powerful and puts forth certain arguments that scare people, right? If we don't have hospitals in every town in America, then people are disadvantaged and at risk. Like, research hospitals don't belong in every single city, right? Research hospitals don't belong in every single town. There are ways to get care at a high level to rural areas. And part of our free will is, in order, if we choose to live in areas that are remote or are rural, some of the consequences is that everything might not be available, right? So even within healthcare, we're sometimes lobbying for things that don't make as much economic sense and doing it for other reasons. Number two is those $100 billion post-lobbying expense profits for the third-party liability carriers have guised their efforts under the purview of tort reform, right? Reform should be progressive. Reform should be something that allows access for more people. Reform should be something that is made better. Instead, they use that moniker to restrict access, to restrict patients' ability to file claims, to increase denials, to restrict appeals, right? They've used two beautiful phrases that I think, Michael, would make both your and my stomach also turn, right? And I'm in the litigated complex claims space. Those two phrases are ambulance chaser and frivolous lawsuit. Who in the world wants to see a fast car driving by chasing an ambulance to a hospital to follow a patient in to represent them? I don't. That sounds appalling. How about frivolous lawsuits? Oh, we processed billions, about $2.5 billion in claims, right? All just litigated and complex. And we've seen millions of patients come through the system. So I have absolutely seen somebody where my neck hurts and I got a fender bender in the parking lot and it's maybe perhaps feels like it might be exaggerated. I am not saying that that has not occurred, but that is not what 90+% of the claims that we see are dealing with. And I certainly have not witnessed a patient volunteer for spinal fusion surgery in the hopes of getting more money, right? And I certainly have not seen a patient who prefers the money over the event not having happened. There isn't anybody that I've ever interviewed, and that is thousands of patients, that says, I'm so glad this happened, and I'm so glad. The money that may or may not come in the end at a high risk, at an absolutely draining, emotionally exhausting process is nominal and only part of any sort of injury that somebody has felt. That's how the system works. And in this reform, when people talk about runaway jury verdicts, folks, there is almost no such thing. Please, 2011, our age can remember the New York Times article in which $2.3 million front page for a spilled cup of coffee. Oh my God, I saw that front page. I was like, that sounds ridiculous. I have to read more. Please, folks, watch the documentary Hot Coffee. This woman in her 70s at McDonald's was given a hot cup of coffee, spilled it, and melted her genitalia. Like, whoa. Yep. And she had $10,000 at the time in medical bills, and she just asked them to pay for it. They refused and offered her $800. A runaway jury verdict is only when you have damages awarded that make corporations change behavior. In discovery, it was found out and makes total sense. The reason that it was 190 or 200 degrees, which should never be touched by a human being at the time, is they were selling millions and millions of dollars in vats that were going to construction sites. And it had to start off that hot to end up warm and hot enough on the construction site. And that was a product that they offered, and they didn't vary whether it was going into a single cup being handed to somebody through a window or a vat that was going to a large group who was going to drink it an hour later out in the cold. So my point is, these runaway jury verdicts are when juries listen to evidence that is usually so egregious and so wrong and so, I will say, evil in many cases, in its hiding or its just overall lack of grace and consideration for what another human being has gone through. And juries will ding companies because those kind of damages are the only thing that can affect change. So when you see states led by insurance lobbying groups wanting to limit the value of a human being's life, right, and restrict any sort of compensation regardless of what corporations do, I would not put that under the guise of tort reform, right? that is restricting access and limiting our ability to be reimbursed for damages that have occurred. And then keep in mind the whole litigated world within this healthcare, and there's healthcare providers also tied to it, right? Because they've provided treatment and are awaiting payment as Gain services these receivables. And it's only out of that award, if any, that they are reimbursed. So claims that fall through, that don't settle, that are written off, right? There is no reimbursement. And so doctors have to be able to feel comfortable treating large number of patients over time to receive what is absolutely justifiably so a premium reimbursement over the government reimbursement rates that I mentioned earlier that simply are not profitable. So I'll stop with that. But these little monikers of tort reform, ambulance chasers, frivolous lawsuits are simply the insurance industry hiding behind the Chamber of Commerce oftentimes to pretend that is somehow in the benefit of, for the benefit of citizens is simply not the case.
Yeah. And there's countless stories, not just, that poor woman that had the coffee spilled on her. And that never make the headlines, but are atrocious and demeaning, and the corporations that are involved in this, will do everything they can not to be held accountable for their actions, and demean and make claims about the individual, and you said ambulance chaser or this, oh, they're just out to get money. No, you permanently damaged a human being. There should be some accountability for that, and too few organizations will own what they do. They make a mistake, take ownership and responsibility for it. It'll serve you better, but that's unfortunately not the motivation for them. So I could talk with you about this for hours, Reid, but let's wrap it up. Where can people find out more about you, this organization, this very important and amazing work that you guys are doing?
So thank you. Gainservicing.com, GAIN, servicing.com is the company's website. My name, Reid Zeising. It's Zeising. You can find me on LinkedIn. Anybody that would like to reach out, I am always happy to talk about these. I am also founding member of APA, which is Americans for Patient Access. So it's a nationwide lobbying group in which we are trying to make sure that care is provided for people nationwide, regardless of payer source. So this is not just for my complex and litigated claim world. This is for access to care for those in need. There are 100 million Americans with less than 4 weeks of savings in their bank account. And if you're hurt through no fault of their own, you stand almost no chance of receiving the same care that I would, given the health insurance that I have. There are also over 30 million Americans who are uninsured. And those people also deserve care, and we are able to provide that in the case of litigated claims. So secondarily, we are members of ARC, or Americans for Responsible Consumer Funding. And that is the ability when people are in tough spots and involved in litigation to pay their bills. Because insurance companies literally tell people, no problem, we'll take care of all of that as soon as it happens. After you have paid your mortgage, even though you're out of work, we may reimburse you. After you have paid for your health care and we deem it to have been necessary, we will reimburse you. How are you doing that if you're one of 100 million Americans with less than 4 weeks of savings? You're perhaps a carpenter who is uninsured, who is then injured and unable to work. Right? So these efforts through Americans for Patient Access, through ARC, myself, I am always willing to speak. I've been nationwide, spoken to legislators everywhere. I am willing to do it with anyone. We're in all 50 states, 20,000 law firms, and over 5,500 healthcare providers. And I am simply dedicated to attempting best I can to pay it forward.
And you're doing that and then some. So, Reid, thank you again for your time today. Really love this conversation, and I hope that everyone digs in deeper and researches this to find out how we can make healthcare better and accessible to everybody. So, thanks again for being on the show, Reid. Appreciate it.
Thanks, Michael.